More about these latest health headlines this morning. Dr. Monica Gandhi. She is a professor of medicine and associate division chief of HIV infectious diseases and global medicine at the University of California, San Francisco. Dr. Gandhi, good morning to you. I want to start with this fungus, specifically in New York, Candida auris. I mentioned a moment ago it's mostly in nursing homes, but it is still pretty concerning. What's the overarching message on this?
So this Candida auris is a fungus that makes kind of what's called a biofilm. So unfortunately, it can be resistant to many antifungals. It is really a fungus that is infecting people who are immunocompromised or are in long-term care facilities. But the rate in New York went up from 291 cases to 379 cases in the last year. It's probably because we use a lot of antibiotics during COVID, which makes fungus thrive. It's also likely because we were really busy with COVID and may not have paid as much attention to infection control. And it's actually cleaned really readily off surfaces. But now that we know about this, we need to clean right. We need to keep people safe from this. And this is really to raise awareness because it's unfortunately very deadly. In immunocompromised patients, up to 50% of patients can die.
So what types of things would health departments in other states and hospital and nursing home settings be doing right now to mitigate it and get the word out?
So one thing is to screen for it. So it's Candida is a very common fungus, but we need to know that it's Candida auris and not Candida albicans, which is really common. So we need to screen for it, do the particular screening test to confirm it. The minute it's in a room or it's whether in a patient's room, you isolate that patient so that you ensure that it doesn't spread anywhere else. And you do deep cleaning of that patient's room, cleaning of the patient themselves, actually, kind of getting rid of it on the surface and ensure that it doesn't spread. So this kind of awareness is tremendously important.
A little bit about fungus in our society. I mean, is there good and bad kinds? I mean, it's around all of the time. How do you detect it? And are there some that we should be more worried about than others?
Right. You're right that, for example, yeast helps spread rise. I mean, there's fungus everywhere, but there are what are called pathogenic fungi. And it's really patients who are immunocompromised on lots of antibiotics that can get this resistant fungi that can make them really ill. So it's really a matter of limiting antibiotic use. We shouldn't be using a lot of antibacterials if we don't need it. And all of that antibacterial use increased during the COVID pandemic. And that what that will do is it will stop giving us selective pressure for these fungi to come out and become pathogenic.
Let's talk about this other new research. Men of African descent at higher risk of prostate cancer. Talk a little bit about the data and what we're learning.
This was a really important study in European urology that you just talked about, that it was actually genetic traits that led to this increased risk in men. So 1 out of 4 Black men in this country will be diagnosed with prostate cancer, as opposed to 1 out of 8 men from other racial ethnic groups. It used to be thought, up to this recent study, that it had to do with disparities in healthcare, maybe not enough access, maybe not enough screening, maybe not the best treatments. It really was all that racial and ethnic minority status in terms of healthcare access. But actually, it's not. It's genetic. And this is an important study that showed that anyone of essentially African descent had 1 of 9 polymorphisms in different genes that led to this increased risk of prostate cancer. The reason that's really important is we need to be more aggressive in screening Black men in this country for prostate cancer. There is actually a way to screen using a blood test. It's called prostate specific antigen. We used to think it was really nonspecific, and now we've come around and we're going to be screening regularly. Men who are older, they should be getting yearly PSA checks. The minute it's high, then you get going about looking at with an ultrasound and seeing if there's actually a nodule in there, something we need to detect and biopsy.
And is that a screening that would happen in a doctor's office as part of like a yearly physical, or would it be something that you could have at the pharmacy to screen for?
This would have to be done in a doctor's office because you really want someone to interpret it for you. And so it's not yet like something you can order online or a pharmacist. You want to have it done by your doctor.
All right, important to know. Dr. Monica Gandhi, as always, thank you. Good to see you. Thank you for watching. Go to newsnationnow.com to find NewsNation on your television provider. And don't forget to click the red subscribe button below to get more of NewsNation's fact-driven, unbiased coverage.